In this video, you will learn how to use closed suction systems of Undis Medical. Preparation: closed suction systems CSS day sticker to remind medical staff to replace CSS in time. Flexible tube, syringe of saline. Instruction for use: remove the disconnection wedge and set aside. Expand the flexible tube. Connect the flexible tube to the CSS. Connect the CSS with patient side. Disconnect the breathing circuit and the endotracheal tube. Connect the flexible tube to the breathing circuit. Connect the CSS to the endotracheal tube. Check suction pressure by occluding the end of the suction tubing. Remove the protective cap of the CSS and connect the suction tubing to the CSS. Twist open the isolation valve. Use one hand to stabilize the CSS and the other hand to slowly advance the catheter into airway to the desired depth. Twist unlock thumb controlled suction valve. Depress suction valve intermittently as you gently pull the catheter out of airway to suction. It is recommended that each suction should not exceed 15 seconds. Stop withdrawing the catheter and release suction valve to stop suction when the black mark on the catheter tip starts to appear in the protective sleeve. Twist close the isolation valve. How to clean? The first option, syringe. Open the cap on the irrigation port. Fix a syringe to the port. Depress suction valve intermittently to clean the catheter. Continue to irrigate until the syringe is empty. Remove the syringe and replace the cap on the port. The second option, infusion set. Open the cap on the irrigation port. Connect infusion line to the irrigation port. Open the infusion line clamp. Depress suction valve intermittently to clean the catheter. Close the infusion line clamp. Twist lock suction valve after suctioning and flushing. Operation done. Disconnect the suction tubing from the CSS. Replace the protective cap. When the CSS reaches the maximum usage time, we need to disconnect it. Disconnect the infusion line before the CSS is removed. Replace the cap of the irrigation port. Slide the disconnection wedge between the CSS and the endotracheal tube. Disconnect the flexible tube and the breathing circuit. Reconnect the breathing circuit to the endotracheal tube. Thanks for your watching.